Advair Diskus is used to control and prevent symptoms of wheezing and shortness of breath caused by asthma or ongoing lung disease, chronic obstructive pulmonary disease, which includes chronic bronchitis and emphysema. It contains two medications, fluticasone and salmeterol. Fluticasone belongs to a class of drugs known as corticosteroids. It works by reducing the irritation and swelling of the airways. Salmeterol belongs to a class of drugs known as long-acting beta agonists. It works by relaxing the muscles around the airways so that they open up and you can breathe more easily. Controlling symptoms of breathing problems can decrease time lost from work or school. When used alone, long-acting beta agonists such as salmeterol may really increase the risk of serious, sometimes fatal, asthma-related breathing problems. How to use? Take the discus out of the foil wrapper. Once the foil wrapper is opened, the discus must be used within 2 months. Hold the discus level with one hand. Place the thumb of the other hand on the thumb grip. Push the thumb away from you until the discus clicks. This will open the discus so you can see the mouthpiece. Hold the discus level and slide the lever away from you until the discus clicks. This will load the medication. Keep the discus level so you don't lose the medication. Hold the discus level and away from your mouth and gently breathe out. Never exhale to enter to discus. Seal your lips around the mouthpiece. Inhale rapidly and deeply. Continue to take a full, deep breath. Hold your breath for up to 10 seconds. This allows the medication time to deposit in the airways. Breathe normally. Close the discus by placing a thumb on the thumb grip. Pull your thumb toward you until the discus clicks. The mouthpiece will be hidden and the lever will be reset. Rinse your mouth out with water and split the water out. Don't swallow it. Rinsing your mouth can cut down on some side effects, like a white coating on your tongue, a yeast infection called thrush, or a sore throat. How to tell when the discus is empty? The discus has a dose indicator on the top of the device. Numbers on the dose indicator shows how many doses are left in the discus. When there are 5 doses left in the discus, the numbers on the dose indicator will turn red. This means the discus is almost empty. When the red number is at 0, the discus is empty. Start using a new discus. Dosing. For inhalation dosage form, aerosol liquid. For preventing an asthma attack. Adults and children 12 years of age and older. 2 puffs in the morning and another 2 puffs in the evening. The dosage should be at least 12 hours apart. Children younger than 12 years of age, use and dose must be determined by your child's doctor. For inhalation dosage form, aerosol powder, Advair Diskus. For preventing an asthma attack, adults and children 12 years of age and older, 1 inhalation 2 times per day, morning and evening. The dosage should be at least 12 hours apart. Your doctor may adjust your dose as needed. However, the dose is not more than 500 micrograms of fluticasone and 50 micrograms of salmeterol 2 times a day. Children 4 to 11 years of age, 1 inhalation 2 times per day, morning and evening. The dosage should be at least 12 hours apart. Each inhalation contains 100 micrograms of fluticasone and 50 micrograms of salmeterol. Children younger than 4 years of age, use and dose must be determined by a doctor. For treatment and prevention of worsening attack of COPD, adults 1 inhalation 2 times per day, morning and evening. The dosage should be at least 12 hours apart. Each inhalation contains 250 micrograms of fluticasone and 50 micrograms of salmeterol. Children use and dose must be determined by a doctor. Precautions. Before using this product, tell a doctor or pharmacist if you are allergic to fluticasone or salmeterol, or if you have any other allergies. This product may contain inactive ingredients such as lactose milk proteins, which can cause allergic reaction or other problems. Talk to a pharmacist for more details. Before using this medication, tell a doctor or pharmacist your medical history, especially of current past infections such as tuberculosis, herpes, high blood pressure, bone loss, osteoporosis, heart disease such as chest pain, heart attack, irregular heartbeat, overactive thyroid, hyperthyroidism, diabetes, eye problems such as cataracts, glaucoma, seizures, liver disease. Advair Diskus side effects. Along with its needed effects, a medicine may cause some unwanted effects. Although not all of the side effects may occur, if they do occur, they may need medical attention. Check with your doctor immediately if any of the following side effects occur: black, tarry stools, blindness, blurred vision, burning, tingling, numbness or pain in the hands, arms, feet or legs, chills, cough, decreased vision, difficulty with breathing or swallowing, eye pain, fast heartbeat, fever, headache, hives of wells, skin itching, rash or redness, large, hive-like swelling of the face, eyelids, lips, tongue, throat, hands, legs, feet or sex organs, nausea, noisy breathing, painful or difficult urination, sensation of pins and needles, sore throat, sores, ulcers or white spots on the lips or in the mouth, stabbing pain in the arms or legs, swelling glands, tearing, unusual bleeding or bruising, vomiting,